evening, and thank you for joining us for this evening's Telephone Town Hall, Community Telephone Town Hall. My name is Tomas Salamanca, and I am Deputy Chief of Staff to Mayor Muriel Bowser. I want to thank you all for joining us this week and every week as we provide an update for the district's response and recovery efforts for coronavirus COVID-19. Before we get started, I do want to remind of a few housekeeping items for our call as we do each week. So if you are joining us from on our phone line, you can press 0 at any time to be entered into the question queue to get any questions you have answered related to the vaccination process here in the district, as we will be joined by Dr. Ankor Shah. So again, if you have any questions, you can press 0 now to be entered into the question queue. If you're watching through our live stream on Facebook or on Twitter, you can also ask your questions directly there. We always take questions from that are shared with us on the live streams as well. So again, if you're by phone, you can press 0 now to be entered into the question queue. If you're joining us by the Twitter or Facebook stream, you can you can ask your questions directly there, and we will take your questions from both the phone and from online. This week, we are focusing on questions related to the vaccination phases in the district and the rollout of vaccines to our residents. And so joining us this week to provide a quick update, and then really we want to reserve the bulk of the time to answer your questions, because one thing I did hear from one of our ANC commissioners is wanting just a bit more time to ask questions of DC Health about the vaccination process. So I want to make sure we have a lot of time for Q&A. So I'm going to hand it over now to Dr. Shah, who is the Principal Senior Deputy Director at DC Department of Health. So Dr. Shah, take it away.
Thank you, and good evening, everyone. I will be brief so we can make sure to have time for ample amount of questions. I do want to provide a quick framework in the at DC Health and as the district allocate on a weekly basis, just so that we're all footing. So in general, we get about 9,000 to 10,000 doses of vaccine a week. It has bumped up extra 1,000 or so recently due to the efforts of the Biden administration. And I think a great way to frame it is about 30% of that vaccine, roughly, goes into our vaccinate.dc.gov, which individuals have the opportunity to use a call center or go online to schedule an appointment at multiple sites across the city. Our equitable approach to the vaccinate.dc portal is prioritizing zip codes that have been of COVID-19 morbid number of cases, as well as the poor outcomes from COVID-19, as well as prioritize who are lagging behind on immunization and coverage to make sure those residents have the opportunity to get vaccinated, plus ensuring that there's plenty of access sites across the district. But there's another 70% of vaccine out there. The other portion of that goes directly to hospitals and health centers. Every single one of our federally qualified health centers have the vaccine. Providence Health System has the vaccine. All of our hospitals have the vaccine as well, and they're doing that individual outreach to bring people in to get vaccinated. Purposefully, I chose federally qualified health centers, for example, to have the vaccine first for their patient population. Again, thinking about that equitable approach. And those are provider groups that provide wraparound services on the medical as well. And then another portion of vaccine goes to special initiatives trying to ease access to vaccines for specific. An example of this is a partnership we have with Johns Hopkins Sibley Memorial Hospital and the authority in which we're vaccinating on-site at senior housing properties. Another one is with Unity Healthcare, partnering with Department of Human Services to vaccinate homeless individuals. Go on and on about these special initiatives, and I'm sure during our conversation we'll have opportunity. But all three of those approaches have an equity focus and aim in mind, and we look at data how we could tweak this process to make it better for district residents. Your frustration, I'm sure, is my frustration, in which we just have a vaccine for the District of Columbia for the need. So we're hoping that our vaccine supply will increase as well. So I'll stop there and happy to answer questions.
Thank you, Dr. Shaw. And again, I'll reiterate that we will continue to amplify that, DC needs more vaccines. So while we're appreciative of the increase from the Biden administration, we will continue to advocate for more vaccine and so that we can move through our phases. So again, I want to remind everyone, if you are joining us by phone, you can press 0 now to be entered into the question queue. I look forward to getting through as many questions as possible with Dr. Shaw. And then if you're joining us online or on Facebook or Twitter, you can also ask questions there directly. So I have Commissioner Elkins I want to go to first in ANC 3D. Commissioner, go ahead. Your line is unmuted. Or it should be in just 1 second. Commissioner Chuck Elkins.
Hello?
Oh, Commissioner, we can hear you now.
Okay, good. Thank you. I have 2 questions, one big one and one small one. Let me ask the small one first. If someone is already able to get their second shot, do they just show up, or will they get some kind of reminder from the district? We're getting questions about that.
Great question. The second dose is the responsibility of the provider who gave the first dose. So that provider should, A, schedule an appointment at time of first dose or reach out about that second dose appointment. If you have not, or there's some miscommunication there, please reach out to us using our call center number or emailing Mayor.dc.gov, and we will happily be the intermediary to connect, sure that second dose appointment and information is conveyed to the individual. But it's really important that second doses are not scheduled through vaccinate.dc.gov. That's only for first doses. And then the second dose is scheduled by the individual provider you received the first dose from.
All right, and then I think we had Commissioner Elkins. I think you had one more question. So, I think we lost you. I think your question, Commissioner Elkins, was how can ANCs help more with the process, and what DC Health sees as a good way to partner with our advisory neighborhood commissioners on vaccination efforts.
That is a fantastic question, because we need our ANC leaders and all community leaders to talk about 2 things. One, engage your community on questions, concerns they have around vaccine hesitancy, and be able to communicate why you feel that it's important to get vaccinated and what you know about the vaccine as well. And then also can get informative around just this registration, the logistics around this vaccination process. You have doctors that have vaccine, you have this portal, you have to show up at your building with a vaccine. So it's a for the individual resident, or it's very understandable why they would have questions as well. So the way that we can work together is that DC Health, we'd love to provide you information to make you feel comfortable to talk about the vaccine, and then you could be those credible messengers. We're going to be working with a group of physicians and really talking about how we could leverage our district to help ANCs at some of these meetings, so you don't have to more on that will be coming early next week to share.
Thank you, Dr. Shaw. Before we go to the next question, I do want to remind everyone again that if you, for our commissioners, if you're getting questions from residents about issues with if their second dose appointment wasn't scheduled at their time of their first dose, or just questions in general about the second dose and issues related to that they can email vaccinatedc@dc.gov. Again, that's vaccinatedc@dc.gov. So I just really want to reiterate that email address. The DC Health team is working very diligently to get to send responses back to the inquiries on that email address. So again, for those commissioners and everyone joining us, we have Dr. Shaw here to answer all questions related to the vaccine process in the district. So if you have any questions, you can press 0 now to be entered into the question queue, or you can ask your questions directly online. So we can go next to Natalie Balling in Ward 4. Natalie, your line is unmuted.
Yes, good evening. How are you today?
I'm great. How are you?
Good. How are you? Oh, sorry, Tomas. Is that to you?
I am just fine. I'm a little nervous because this is my first time, but I'm a Ward 4 resident, and I work at a local grocery store, Safeway. And as you know, they rolled out through our pharmacy vaccination. So I'm regularly asked questions by everybody who, whatever phase that they're under. They wanted to know, is it my turn? Is it safe? And especially with the African-American community. And I just wanted to know, what can I do at a broader spectrum to try to help out? Because I definitely want to help out. I answer questions, and I'm definitely not in the medical field, but I try to make people at ease and more comfortable with receiving a vaccination.
Well, first I want to thank you for being an essential worker and providing essential service in the District of Columbia. And two, being a partner to talk about the vaccine, especially at those stores in which you have folks wanting to get the vaccine or thinking about the vaccine, and you have the opportunity to talk with them. I suggest really thinking about why return, and if I were to think about when I think about myself, it's really to protect myself, to protect my family, my community. And this is our way in which we know what deciding not to get the vaccine will do, that door looks like, because we've been experiencing it for the last 10, 11 months, and it's horrible. There's a lot of people that get sick and die because of our COVID-19 pandemic. About when it's your turn getting the vaccine, and that's our way out as a community, as a city, to put this pandemic behind. And I think that is, one message. If you feel the same way, I would really encourage you to say it. And then a couple things. This vaccine that are currently on the market, they're highly effective, over 95% effective. And then you will get common of a sore arm, maybe even a fever, or having body ache a day or two after, and it goes away. But that's completely normal. There is a very safe and effective vaccine. I think as long as you could communicate why you personally would get it, and that is safe and effective, you're doing all of us, you're doing more than your share already, and we appreciate it.
Thank you, Dr. Shaw. Again, I want to remind everyone, if you have questions, you can press 0 now to be entered into the question queue. If you're joining us by phone, if you're joining us online, you can ask your questions directly there. I've got a question about when people are getting their second doses scheduled. I think Dr. Shaw answered that already, but just a reminder, when residents are going to receive their first shot, the provider should be scheduling with them their second dose. So that's a question there. But again, if there's any issues with second dose appointments, you can reach out to vaccinatedc@dc.gov, as that is the email address. We are going to go to Jacqueline Neer in Ward 2. Jacqueline, your line is unmuted.
Thank you. My question is, for the second shot, can one go to a different provider than the original dose?
Thank you for that question. And in short, no, you have to go to the same provider group, but that could mean a different location. For example, with our Safeway pharmacies, you may have gotten your first dose at a second dose is scheduled at one of our community living centers as well, but still offered by Safeway. The rationale for that is really a little bit technical and logistical, in that all second dose deliveries are tied to the first dose of delivery. So if you're a provider or your pharmacy who gets 2 to 3 weeks later, you're getting another 100 doses of vaccine for the second dose. So because they're tied together, we have to go to the same provider. So no one who has a second dose vaccine will be able to, or won't be able to receive it if they don't.
Thank you, Dr. Shaw. We're going to go to our next question, and we are going to go to Ellie Carney in Ward 8. Ellie, your line is unmuted.
So, Dr. Shaw, my question is, why is there a shortage on the Moderna vaccine?
Wait, was the question, why is there a shortage on the Moderna vaccine? I apologize.
Yeah.
So there is, I would say there's a shortage on both vaccines. Because of this little change by the Biden administration for a vaccine, 15% for the next few weeks, we're the Moderna vaccine as well, but we don't have too long. I think it is just frustration that we just don't have enough vaccine. And D.C., as you know, we are one of the best in the nation in getting shots in the arms, as they call it. We need more vaccine. If we get more vaccine, we're able to use it as well. For all intents and purposes, it seems as though that production of having a ton more vaccine is not going to happen in the next few weeks. It might be end of February, March, where we might see some sort of real increase in vaccine production. But that is still in theory and thoughts. Nothing has been firmed up from the federal government to us yet, long term.
Thank you, Dr. Shaw. We are going to go next to David Knight in Ward 6. David Knight, your line is unmuted.
Good afternoon. I wanted to ask about the possibility of a wait list for the vaccine. I know that the council has been asking and haven't seen anything in the daily updates from Department of Health, and so instead elderly residents are forced to compete for very few appointments day in and day out rather than just getting on a list and waiting their turn.
Thank you for that opportunity to highlight a couple things. First, I agree with the frustration when for the 30% of vaccine that's good, the demand is so high that the portal isn't able to be online for that long, but make sure to reach seniors who are having trouble. Specific question about a wait list is our focus using data about priority and really ensuring that we have equitable distribution of the vaccine to ensure coverage across the district requires possibly lean in certain communities to ensure vaccine access as well, so that creates a place where you can be a little more nimble as opposed to a wait list in which up and therefore you're a certain number, and that number is a vaccine as opposed to possibly your geographic zip code or risk stratification as well. So that's number one. However, moving to a new technological solution, I agree with you on the phone that we could have a much better experience with the current system we have, but the demand is just so high. Our new system is going to separate registration from scheduling. And I think once we separate registration from scheduling, we'll have the opportunity of easing that anxiety of scheduling an appointment right away. There will not be, though, that wait list where you register and then say you are number 600, 5,000 for a vaccine, which you could be. You could sign up and say you're number 7,820 via the portal. I don't know if that really anxiety. Also, there's that other 70% of vaccine out there who's getting into arms as well.
Thank you, Dr. Shaw. Again, we want to remind everyone, 0 if you have a question, and you'll be entered in the question queue. We've got about 10 more minutes in the call, so we want to work through as many of our questions as we can. Commissioner White in Ward 8, we can go to you next.
Good afternoon. Thank you so much for this briefing. They've been very helpful. Quick question on targeting in Ward 8. We know that about 1% of folks who've gotten vaccinated have come from Ward 8, but we do carry the highest death rate. I'd like to know, what are your plans for targeting in Ward 8, increasing access to vaccines in Ward 8, measures such as dedicating a certain percentage of vaccines every week to Ward 8 residents, actively calling eligible Ward 8 residents so they can sign up. There's a lot of folks over here who want to be vaccinated. Yes, there's some work to do with community sensitization, but a problem is whenever they're trying to access it, all of the slots are gone. And I'm calling for neighbors. I'm trying to set them up. I'm calling health centers, and everything's gone. So I like to know, what are you going to do? What can be done to bring real equity in bringing vaccines over here? And in addition to like that question, what are you going to do now? And for the future, for the 70% vaccine, if we, who is that going to? I just want to make sure that we know that the highest percentage of deaths are African American people, and making sure they're getting the vaccines that's going to keep them protected. I don't know if this heard much about the 70%, except for the last call, but just want to make sure there's some equity, more racial equity in this process.
I completely agree with you on all of your points, and I can explain a little bit about what we're doing now and what we are intending to do. And every week, we're going to try to get ensuring those at the highest risk zip codes, wards, have access to the vaccine. So through the portal, this week, it's wards 5, 7, and 8, as opposed to 1, 4, 5, 7, and 8, because we saw considerable uptick from wards 1 and 4 in the previous weeks. But that's only through the portal. For the other 70% hospitals that have the vaccine, for example, United Medical Center gets a higher proportion of vaccine for its patient population than some other hospitals as well. Population is they serve. Similarly, with the federally qualified health centers as well. But you're absolutely right. The demand is too much than the supply. And then there's all these other special initiatives. So, for example, the seniors who kind of don't want to mess with the portal, we're developing exactly as you said, getting our volunteers, leveraging our mayor's office for community relations to get out there, knock on doors, call people, help them schedule and get registered, working to have vaccines on some properties. And more of these initiatives are rolling out that really focused, starting with Ward 8, but also 5, 7, and 8 as well. Different ways and methods outside of the portal for your residents to ensure access to the vaccine. It is a good thing that there's high demand. We are going to try to meet that demand as much as we can.
Thank you, Dr. Shaw. And I'll just add to what Dr. Shaw said, Commissioner. We've also been doing a very coordinated effort here at the Executive Office of the Mayor with DC Health on communications and engagement in Ward 8 as well, and Ward 7, but question related to Ward 8. We did a mailer to just this, I think a week ago, or should have hit mailboxes last week, to seniors that are 65 and older in Ward 8 about information about the vaccination portal, hotline, and those other healthcare providers such as UMC that are providing vaccination appointments to seniors. We've also done robo-dials out into the community. We'll continue to do those to get more of the word out. And then I know there'll be much more that we'll be announcing in the coming days about engagement with residents in Ward 8 and Ward 7 on getting them signed up for vaccination appointments. So we agree, we hear you. We want to get those appointment numbers and those vaccination numbers up in Ward 8 and Ward 7 and Ward 5, which are priority zip code wards this week. So we appreciate that question and look forward to partnering with you, Commissioner, as well on getting some of this material and word out with residents in the area. So we thank you for that question. I'm going to go next to Jack Warner in Ward 4. Jack, your line is unmuted.
Thank you. This is Jack. I wanted to ask two quick questions. One, we'd really like to see CVS become a partner in this, especially out here in Ward 4, since they do the flu shots and been doing an excellent job in that area. So I want to know if there's any movement to get CVS involved. And secondly, as it relates to getting into the call center, the operators, when they answer, they have to go through getting a whole bunch of information about you. And by the time they get that information, they're talking about, an appointment at a site, and then all of a sudden the appointments are all gone, and the site's gone. Is there any way they can lock in the appointment at the site and then get all the information collected about us? And also, can they do that as a couple so that my wife and I can go at the same time?
Thank you for the question. For your first, CVS as a provider, so they are a partner specifically in vaccinating our nursing homes since end of December. However, the number of access points across the district are 5 to 30 access points. So even though the CVS stores are not offering vaccine, in terms of pharmacies, Giant Pharmacy, Safeway Pharmacy, Walmart Pharmacy, and Harris Teeter next week will be offering vaccine. So we're really leveraging our pharmacy partnerships in addition to our health. Completely hear you and take your feedback on the call center and that ability to register for an appointment. Basically, they're using the same system that anyone who goes online to use. So technological solution comes on board, we'll make that process separating registration from scheduling, which should ease that burden at this time and outweighing the supply. And it's hard to work with that until we get more vaccine. Again, if the federal government told us tomorrow we're getting double the amount of vaccine, we'll be able to use it in a week. So we have the capacity in the district. We just need more vaccine.
Thank you, Dr. Shaw. We have time for just a few more questions. So again, if you're in the question queue, you can press 0 now. We'll take just a few more. We are going to go next to, I just lost your name. There you are, Jen Roush. Jen Roush in Ward 1. Your line is unmuted.
Taking my call. I had a two-part question regarding chronic conditions and then another question regarding distribution. So very briefly on the chronic conditions, because I know we're short on time. One, can you give an update on when you expect to be able to open up the vaccine distribution for individuals with high-risk conditions, medical conditions? A follow-up on that is, how does an individual with a chronic condition get on the list for individual hospitals? My understanding is that you have to have been a patient at the hospital within a period of time, 12 months or something. And so I'm not, I haven't been hospitalized, but I do have a chronic condition. So how do I become part of that outreach? And then lastly, in an unrelated question, have you considered a lottery system? So I have an elderly father in Minnesota, and they've been very successful employing a lottery system that has the advantages of, one, getting rid of the first come, first serve problem. It also, has potential appeal in the sense of encouraging people to take up the vaccine because, winning a lottery is a good thing, right? And then, that there's no reason that couldn't be used to rather efficiently distribute the vaccine based on whatever set of rules you want to use so that you have an equitable distribution. I'll take the answers offline. Thank you.
Thank you for that question. And really briefly, have such high demand among seniors 65 years and older. We haven't begun moving into the chronic disease phase or rollout. Before we enter that phase, we'll be able to provide a lot more what those parameters and a lot more information and criteria individuals will need closer to that time. Right now, the focus is really on 65 years and older, and I feedback on the lottery system. And when we have that ability, we'll definitely sterilize it. Thank you.
Thank you, Dr. Shaw. We're going to go next to Heather Foote in Ward 1. Heather, your line is unmuted.
Yes, I attended the Commission on Aging meeting last week, and my question also relates to equity and the distribution to seniors. I'm wondering what data the district may be using on digital connectivity of seniors 65 and above. In other words, how many own laptops and smartphones, and whether you can zero in on them. I think the mailer was a great idea, but zeroing in on people who are going to have trouble registering is really important. I do a lot of outreach to the Ward 7 and 8 senior wellness centers, so I'm very familiar with this challenge.
Thank you for the question. A lot of the data we use includes information that you could use in a social vulnerability index as well to identify that you want to develop and drive more resources into, as well as the data on who's actually getting immunized and where do they live as well. And based on that, that really changes our scheme and mechanism to ensure access to those individuals. So, for example, it's an area that is having a lower uptake of vaccine, portal access, but these special initiatives working with their hospitals and health centers to really reach into those populations and identify patients are the strategies we use. So there's multiple pronged efforts by using that data to bring folks in to get vaccinated. And we are, again, as soon as the vaccine that we have, we are getting them into the arms of those individuals. Their coverage is changing based on this type of focused effort, but there is just too much demand compared to the supply that we have.
Thank you, Dr. Shaw. We're going to take one last question. I'm going to go to Commissioner Moore, Sidell Moore. Commissioner Moore, your line is unmuted.
Thank you. I just had one question and one comment. Firstly, my question is, I have seniors who are, still waiting to be vaccinated, and then the local Safeway here at Heckinger Mall has seen lines of people who are waiting until the end of the day just in case there's some extra vaccine, left over at the end of that day. Is there a policy in place to prioritize those seniors who are still waiting to be vaccinated, if they were to wait in those locations at the end of the day, rather than just kind of whoever happens to be there at day's end? And then just an additional comment, a lot of my seniors have been told to continually call in order to get spots and have not been able to get them. But I think they would prefer to be on a waiting list as opposed to maybe a lottery or some other system or having to repeatedly call in. And I'll take the answer to my question offline.
Thank you, Commissioner. I don't know if Dr. Shaw wants to add anything. I know we'll follow up with some additional follow-up. Dr. Shaw?
Nope. I completely I hear you. One thing I do want to make a point is that we are discouraging queuing or creating a line waiting for extra doses at any of our provider sites, including the pharmacies. We're instructing our providers. They really have a wastage strategy, so they've identified other people if there are extra doses, such as the grocery store workers who are there are identified for potential wasted doses, as opposed to anyone waiting in line. We do not want to keep on having folks show up and wait all day for an extra dose as well, only not to get it, or that system of whoever shows up first gets the dose. And we'll continue to work with our providers to ensure that policy is enacted.
All right. Well, I want to thank Dr. Shaw for joining us this evening to answer your questions. I am very confident that I will likely have him back next week if he's available, since we had so many great questions. So thank you in advance, Dr. Shaw. I want to remind everyone on the line, I know we had some questions we ran out of time for, but your MOKERS representative, who are our co-hosts of this call, will follow up with you for any follow-up questions to get answers if we weren't able to get to those questions today. So we will get some follow-ups to you all on your questions. And I want to remind everyone again, for the most up-to-date information and resources related to our efforts on coronavirus, you can visit coronavirus.dc.gov. We have all of the vaccine phases on the website, as well as other pertinent information related to the vaccination process there, and as well as all of our data and other information that's critical for you to have. So again, that website is coronavirus.dc.gov. Thank you all again for joining us each and every week, and we will see you next Wednesday at 5 o'clock. Thank you so much.